Hey folks, this is Josue with Throwing Down Fitness and an episode about functional restoration. The reason I do this is because on occasion I work with patients that have chronic pain issues, usually starting with the neck, low back, it could be an arm, hand issues, maybe something like chronic regional pain syndrome, and maybe some issues going down the feet like plantar fasciitis. And I want to cover some of these topics, and I'm going to cut them up in sections and then do one as a whole functional restoration type of series exercise. But the first one I want to cover is neck. It's really important that we cover our neck because sometimes all of our stress and tension comes from this area and builds up. Okay, so I do want to give you a fair warning though. If you had a recent surgery or trying to prevent a surgery, please talk to your doctor and maybe a physical therapist. These are some things that I have learned in the past from patients that I have worked with, and hopefully these may be able to help you. Again, don't go to pain. Slight discomfort is okay, but do not try to hurt yourself. When we're trying to go for functional restoration, you want to go to the point where you can feel some slight tension into the stretch, and it may be millimeters or it could be centimeters, maybe an inch or two when you're going into a stretch. But don't get so aggressive because you want those immediate results, okay? Take things slow, little by little, you'll make progress. Okay, so what I'm going to do is basically cover things that where people have upper cross syndromes, where they're like this, or maybe they have a fusion in their neck and they're not getting an opportunity to work their neck muscles as much. So we'll start with the chin tuck. We'll go straight.
Rest.
I'm going to pause that.
Pausing session.
That's my actual timer to help you guys out. So it's called Tabata Pro. It keeps you in good, proper timing to make sure you give yourself sufficient rest. So look for a timer that might help you. You could use a stopwatch or just watch a clock while you're doing some of these exercises. For now, we're going to hold the stretches for about 5 seconds. And we're going to start with the chin tuck. So we're going to cover our upper cross. We're going to do neck, shoulders, and maybe some lats in this series, okay? So first one, chin tuck, going straight back. 5-second hold. You're making a double chin basically. You're not moving your chin down, you're not moving it up. And again, go to slight discomfort. Don't go so far back. Go where you feel slight discomfort. I can't tell you how much this is important because some people might force themselves into a position too much and might get themselves really hurt and may be in pain for the next 2 or 3 days. If you have chronic pain, make sure you pace yourself. Really, I care. So slowly, 5 seconds, go back. 5, 4, 3, 2, 1, and relax. So that's your base, a chin tuck. You're going straight back. I relax for about 5 seconds and I go right back into it. Go straight back. 5, 4, 3, 2, 1, and I relax. The reason I use my finger is to make sure that I'm going straight back. So if I'm very limited and I'm very stiff, I won't know if my body is actually doing something. So I use my finger as a guide to push on the chin to make sure that I'm going back, okay? Again, here we go, 5-second holds. Back, 5, 4, 3, 2, 1, relax. Going back, 5, 4, 3, 2, 1, relax. Here's a side view. Going back, 5, 4, 3, 2, 1, relax. Again, going back, 5, 4, 3, 2, 1, relax. Now straight from the back so you can take a look right here. Yeah, I go back, 5, 4, 3, 2, 1, relax. Again, 5, 4, 3, 2, 1, relax. That's roughly 10. You want to do about 10 to 15 repetitions based on what you feel comfortable. If you are a person that has chronic pain, again, I can't encourage you so much. You need to go talk to a pain specialist. There's a couple of them out there. A physiatrist would be a good one. Maybe a neuro a neurologist would be a good one as well, because they studied nerve damage and stuff like that, because you might have some type of nerve damage. It may not be muscular or it may not be bone. So talk to them as well. Next one, we're going to add on this as a foundation. So we're going straight back, chin tuck, and now we're bringing our shoulders up to our ears, okay? So chin back, shoulders up to our ears, holding it for 5 seconds. 5, 4, 3, 2, 1. Slowly bring your shoulders right back down, okay? You don't want to just drop your shoulders, because you don't want to pull on a nerve, especially if you have nerve issues, okay? Or you have some disc or bone issues, okay? So if you have a spinal column issue, you really don't want to be manipulating the bones where they're really loose and just jerking them around, okay? So again, up to your ears, but first start with the chin tuck, going straight back. 5, oh, sorry, chin back, shoulders to ears. 5, 4, 3, 2, 1, relax. Okay, here we go again. 5, 4, 3, 2, 1, relax. One more time. Chin back, shoulders to ears. 5, 4, 3, 2, 1, relax. Now I'm going to change side angle so you can see what it looks like from this position. A lot of people might be like this that have lots of pain, okay? So if that's you, you really have to work on that, and maybe you need to put a pillow up against the wall and start doing some pillow squeezes. That's another series we'll go into, but for right now, chin back, shoulders up to your ears. 5, 4, 3, 2, 1, relax. Chin back, shoulders up to ears. 5, 4, 3, 2, 1, relax. Chin back, shoulders up to ears. 5, 4, 3, 2, 1, relax. I'll change angle. Chin back, shoulders up. 5, 4, 3, 2, 1, relax. Chin back, shoulders up. 5, 4, 3, 2, 1, relax. Chin back, shoulders to ears. 5, 4, 3, 2, 1, relax. That should be 10. Now, we're going to do a shoulder blade pinch. Basically, we're bringing our shoulder blade straight back, a scapular pinch, okay? So we're going to start with their chin. Chin goes back first. So here we go. Chin back. Make it like a bird chest. Here we go. 5, 4, 3, 2, 1, relax. Chin back, shoulders back. 5, 4, 3, 2, 1, relax. Chin back, shoulders back. 5, 4, 3, 2, 1, relax. Here we go. Side angle. Chin back, shoulders back. 5, 4, 3, 2, 1, relax. Chin back, shoulders back. 5, 4, 3, 2, 1, relax. Chin back, shoulders back. 5, 4, 3, 2, 1, relax. Here we go. Chin back, shoulders back. 5, 4, 3, 2, 1, relax. Angle from the back. Here we go. Chin back, shoulder blades back. 5, 4, 3, 2, 1, relax. Chin back, shoulder back. 5, 4, 3, 2, 1. Relax. Chin back, shoulder back. 5, 4, 3, 2, 1. Relax. One more. Chin back, shoulders back. 5, 4, 3, 2, 1. Relax. Now the next one, I'm going to give you a side angle because this one's kind of tricky to describe. We're going to do a scapular retraction. So our shoulder blades are going to go down and diagonal. So I like to do it like as if we're doing circles with our shoulders. But again, remember our foundation, we have to bring the chin back. It's really important for good posture. So we'll start with the chin going straight back. I'm going to bring my shoulders up, back, and then go straight down when I'm down and back like that. Okay? There we go. That was at least 5 seconds. I'm going to do it again. So here we go. Chin back. Here's the movement. Little shoulder roll, and I'm staying at the bottom and back. 5, 4, 3, 2, 1. Relax. Chin back. Little roll. Stay at the bottom and back. 5, 4, 3, 2, 1. Relax. Again, chin back, shoulder roll, down and back. 5, 4, 3, 2, 1. Relax. I'm going to face you. Chin back, shoulder roll, down and back. 5, 4, 3, 2, 1. Relax. All right, here we go. Chin back, little roll, down and back. 5, 4, 3, 2, 1. Relax. Again, chin back, shoulder roll, down and back. Hold. 5, 4, 3, 2, 1. Relax. Different side. Actually, I'll go this way so you can see me directly from back here. Chin back, shoulder roll, down and back. 5, 4, 3, 2, 1. Relax. Chin back, shoulder roll, down and back. 5, 4, 3, 2, 1. Relax. Chin back, shoulder roll. Hold it down and back. 5, 4, 3, 2, 1. Relax. Now when doing this exercise, it gets really hard to think about it. So it's really good to try to do this in front of a mirror to watch yourself as a guide. So I know you're going to be watching it here on the YouTube channel, but try watching yourself as well as your guide, because you're going to be your best indicator whether you're doing it correct or not. Not me over the YouTube channel, okay? So one of the common mistakes when people do that is that they shoot their head forward when they do the roll. So they'll do this and the head will shoot forward like that. Try to prevent yourself from doing that. Keep that chin back. That's really important, okay? Now we're gonna do something called the Serratus Punch. You're basically gonna bring your shoulder blades outward like this, away from your spinal column. So I'm going forward, so you can see my shoulder blades right here, and I'm gonna try to shoot it in front of my chest. So it's past my chest right here. Now I'm getting my shoulder blades back here to stretch out. You can either do it with one arm, just like this, both arms. I personally like interlocking my fingers, shooting both shoulder blades forward, just like that, and then try to deviate your elbows to the outside. So you go out here and like you're separating your fingers, but you don't, you clamp on. So that way you get both sides at the same time. So I'll shoot my shoulders forward, just like this, and elbows to the outsides, just like that. I'm holding it for roughly 30 seconds. So we did a lot of things right now to create a lot of tension in our neck. This one is more of a stretch to get those muscles to start to relax, okay? A couple more seconds, hang in there. You guys are doing great. I say about 10 more seconds. 5, 4, 3, 2, 1. Relax. Great. So that was posture level 1, a series of exercises that you can do to reduce some of that chronic pain that you may be having here. Now, to continue with the neck muscles, because some of us might be really tense on one side over the other, here's some extras. It's a bonus, okay? So if you have lots of tension right here on this side, you're really tight, you may want to do some additional stretches on your left side, okay? So I'll put my hand gently on top of my head and tilt. Just the weight of my arm will give my head a gentle pull. I won't pull with my arm, okay? So it's just right here. Allow myself to get a gentle stretch. And in these stretches, I'll hold it for about 30 seconds to a minute. Depends on your comfort. You can do it a lot less. It might be 10 seconds, 15 seconds, but at least try to shoot for a goal for 30 seconds. Work your way up to it, okay? If you want to increase this stretch, put your hand behind your hips, like this if you're standing. All right, good deep breath. Relax. Gently and slowly return back to neutral. I'm going to turn around so that you can see what it would look like from a back position. I'm going to lean and tilt in this direction now so that I get both sides. There we go. Hand gently on top of the head. I'm going to maximize the stretch. I'm going to put my hand behind my hips just like this. Just allow the gentle pull by the weight of my arm to stretch my neck. Nice deep breath. Let go. Slowly help yourself up if you need to. Again, be gentle with your body. Don't hurt yourself. Okay. Now, we're going to look to one shoulder. Doesn't matter if you start with the left or to the right, but I will start by looking to my right. Hand, same principle, goes on top of my head. Just like this, and then we're going to tilt our head down. Just like that. Same principle, you want to maximize the stretch. Put your hand behind your back. Good deep breath in through your nose, out through your mouth. Okay. Next side. Here we go. Same thing. Now I'm going to look to my left. Hand goes gently on top of the head. Hand goes behind the back to maximize the stretch. And just a gentle pull. Big deep breath. Again. Nice and gently, come right back up. And there you have it. Not very hard. That's a great neck exercise, upper traps that you can do at home. You know, you don't need to be at a gym. So slowly pace yourselves. In fact, on this YouTube channel, I'm going to see if I can attach a handout so that you guys can track your exercises. This one will be a posture series, and there's a couple of other series that I can continue to add for your neck and shoulders. And really take into consideration how you're doing during these exercise sessions. The first time you may be sore, tender, and you may feel some pain. That's perfectly normal. remember, you may probably have not done some of these stretches in a very long time, or perhaps have never done them before. So expect your body to react to it. So if you're in pain, what you need to do is reduce it slightly. Find out that comfort zone. So maybe instead of holding it for 5 seconds, it might be 3 seconds. Okay? If your stretch for this one, for example, was too long for a 30-second count, reduce it. Let's go down to 20. Let's find the place where you feel most comfortable and then slowly work your way to it. So in a Excel sheet that I'll probably produce, it'll be something very simple like, how many sets did you do? Right now we only did 1 set of 10 repetitions for 5-second holds, and except for the last one, which was a 30-second hold, okay? And that was for the Serratus Punch, which is this one. I like doing the barrel hold like this. So that's a 30-second hold, but everything else was 5 seconds, and you just slowly work your way into it, okay? You may want to do a set and separate it throughout the day. A set in the morning, a set midday, and maybe a set at night. That's, again, this is something that you're going to do to be proactive, to make yourself more functional. And when I ask you to track it, I did 1 set today, 2 sets, 3 sets of 10 repetitions, and then the workload that you're doing is going to pay off. I promise you, okay? Now, not everybody's going to get instant results. Everyone will progress little by little, but you should try to do it at least every other day. Don't do it every day because you may exacerbate the pain a little bit too much, and you may be in bed for too many days, and that's not what we want. We want to make sure that you're able to be more functional, to be able to handle a conversation and hang out with family and friends, and you're not closed off in your home, and you're actually, feeling better, getting back to normal. This video is specific for chronic pain patients, and hopefully this message helped you. Okay, stay tuned for the next videos. I'll do something for carpal tunnel, elbow issues, low back. I know it's really popular, and then we'll start doing some strength training as well. Maybe something with weights, but this might be too heavy for a lot of people. And in fact, what I just did was very bad form. Okay, so stay tuned for the next couple of videos. They'll be coming out possibly weekly. It might be bi-weekly, just based on how busy I am. And yeah, I hope you really liked it. Again, try to go for 3 sets. If you can't, it's okay. Shoot for 2 sets. If you can't, 1 set, and then work your way up to it, okay? Take care.